Good morning and welcome to another Medical Minute with the Colorado Springs Orthopaedic Group. Right now I'm joined by Dr. John Redfern, a board-certified orthopedic sports medicine physician, and thank you so much for joining us.
Thanks for having me.
Yeah, absolutely. And today we're talking about knee instability. And tell us a little bit about the signs and symptoms to look out for.
Well, they're usually not subtle. They usually occur traumatically and quickly, but it's anytime the knee is not giving you a stable platform, you feel like your bones are shifting out of position and not able to do some of the activities that you want to do, such as certain sports, running, jumping.
And what happens when the knee becomes unstable?
Well, when it becomes unstable, patients usually know it pretty quickly. They really feel like something shifts out of place. They don't trust their knee in doing certain activities. These are usually running, cutting, jumping, sport type of maneuvers. And they usually come in and see us pretty quickly when these things occur.
Are there ways that people can treat knee instability at home?
There's some initial treatments they can do. Certainly they can stop those activities that are causing those symptoms. They can use some simple soft knee wraps and braces around the knee. If there's swelling, ice, elevation. And if they can take anti-inflammatories, some Aleve or ibuprofen will help them.
Okay, and when should someone actually see a physician for this?
You know, if this is a new symptom that occurs and is bothersome to the patient, they should pretty much see us as soon as they can. This is something that if it goes undiagnosed can cause more problems in the knee, which can cause have some consequences later in life.
And what are some treatment options that are available for this?
Well, non-operative treatments, certainly some physical therapy, certain bracing that we can give them, strengthening of the legs, hips, the core, and modifying their activities. When those things don't work, then there's certainly surgical options that we can do to stabilize somebody's knee or shoulder.
Okay, and are there some preventative measures people can take to prevent this from happening?
Certainly staying in as good a shape as you can. So that's going to be watching out for your body weight, working on strengthening of your legs, hips, knees, your core strengthening, and really becoming more sport specific and getting ready for those sports that you want to do and not just jumping right into them, but preparing.
And what is the typical recovery time if surgery is required for this?
Well, certainly it varies on exactly what you're doing in the knee, but it's lengthy. You know, if you have surgery, you're on crutches at least for several weeks, up to 6 to 8 weeks in certain circumstances. And full recovery, getting back into full sports, depending on what you're doing, can be up to a year.
Wow. And so if someone comes in for their first appointment for this, what can they expect?
Generally, they're going to expect an examination, certainly usually start out with some basic x-rays. Oftentimes, these diagnoses require further imaging, such as an MRI, to evaluate those soft tissue structures that are causing the instability.
And when do you kind of start talking about treatment options and figuring out, okay, we can do this, and then surgery is required? So when can you kind of differentiate?
Really depends on symptoms and how they're handling the injury and the instability. If they're able to have a functioning life, doing the things they want to do with some simple activity modifications and therapy, then that works great. Oftentimes that's not the case, and if that is failing them, then we talk about surgical options.
And when people recover from this, I mean, what is the main thing you hear after they're better?
They're certainly much happier to be able to get into those activities they want to do, getting back into the life they want to live, especially out here in Colorado, very active community, and so they're grateful.
Is there a specific age group this impacts more so than others?
Typically younger patients, those in their teens, and 20s and 30s, but in an active community like this, it affects folks also in their 60s and 70s.
Alrighty, well thank you so much for joining us today. We really appreciate it.
Thanks for having me.
Absolutely. And if you'd like more information on the Colorado Springs Orthopaedic Group, just head to csog.net.
Heard our csog.net, and the segment has been sponsored by Colorado Springs Orthopaedic Group. Now